Will this bill increase or decrease the deficit?
My view that over the 10-year window, it will decrease.
You have said that government spending is, quote, out of control. You have also called government spending, quote, unsustainable. Why is the national debt so very important that you're trying to kick 16 million people off their health insurance?
A huge portion of this goes to family-owned businesses that are pass-through entities.
The part that troubles me the most is that the secretary is deeply worried about the deficit and is willing to knock 16 million, or as he says, merely 11 million people off their health. Thank you, Mr. Chairman. So I want to ask about the Republican big, beautiful bill, which will knock about 16 million people off their health care coverage and cut programs that keep groceries cheaper for millions of families in order to try to pay for about $4 trillion in tax giveaways that are mostly going to be sucked up by millionaires, billionaires, and wealthy corporations. So, Mr. Bessent, Secretary Bessent, I'd like to start with a very simple question. Will this bill increase or decrease the deficit?
They're varying scoring on that, Senator
You're
Warren.
the Secretary of the Treasury, so I'm asking you, what is your view? Will this bill increase or decrease the deficit?
It is my view that over the 10-year window, it will decrease.
You know, do you have anybody who agrees with you on this?
Yes, ma'am.
Let me ask my question.
Okay.
Every credible independent expert agrees that Trump and the Republicans' big, beautiful bill would add trillions of dollars to the national debt and would not even come close to paying for itself. The nonpartisan Congressional Budget Office, the Penn-Wharton budget model, and the Yale Budget Lab all agree on this, and they're looking at 10-year windows, thank you. So do the Conservative Tax Foundation and Committee for a Responsible Federal Budget, conservative groups. Even Elon Musk and the Wall Street Journal are criticizing the bill for ballooning the national debt. The only people who are saying publicly that it's not going to add to the national debt are you, Donald Trump, the Republicans in Congress. Do you have an independent group that has put forward numbers that disagrees with all of these conservative groups and disagrees with the Wall Street Journal on this?
Well, Senator, interesting to see you aligned with Elon Musk, but if I add...
You're no more shocked than I am.
If we want to take the full congressional budget scoring, they predict, and I don't agree with their methodology, they predict a $2.4 trillion deficit. But
okay, so the answer to the question is yes.
No, but may I finish? They include that, but they've also scored $2.8 trillion in tariff income. So even in Washington, D.C. math,
okay, so,
in Washington, D.C. math, that is a $400 billion surplus.
Okay, so let me make sure I understand. This bill, you admit, will increase the deficit by $2.4 trillion, but you think there will be another bill and another set of agreements that somehow materialize, haven't materialized so far, don't have any statutory authority, but that will make up the difference. So the answer to the original question, will this bill increase or decrease the deficit? I think you just said it will increase. This bill increases the deficit.
No, I want to use all the CBO scoring, and you can't take one without the other. I don't agree with the CBO.
One is the law that we are scoring, the bill that is in front of us. We don't have a tariff bill in front of us to score. Mr. Secretary, let me go on to the second question. You have said that government spending is, quote, out of control. You have also called government spending, quote, unsustainable. In fact, in the name of fiscal responsibility, you're working with the Republicans on this big, beautiful bill to pass the biggest cuts to Medicaid and the Affordable Care Act in American history. So, Mr. Secretary, help me understand here. Why is the national debt so very important that you're trying to kick 16 million people off their health insurance, but increasing the national debt doesn't seem to matter if you're cutting taxes for billionaires and billionaire corporations?
Well, first of all, a huge portion of this goes to family-owned businesses that are pass-through entities that are below that level, Senator, and I am sure you share my goals of Main Street prosperity.
You know, I'm glad to do tax cuts for people of modest means. The question I'm asking is, why does the deficit not matter to you? We're talking about knocking 16 million people off their health care, but it matters It does matter to you if we're knocking people off their health care, but not.
Well, first of all, that figure is overstated by 5.1 million. That is amount not attributable to provisions in this bill.
So you think it's okay just to knock 10 million people off their health care?
First of all, let's set that straight. Work requirements account for 8 million of CBO's claim number. Again, we're creating an economy that promotes and rewards.
It's clear, Secretary Bessent, that you don't want to answer the question.
No, Senator, I am answering it.
No, you're not.
And what I want is for Medicaid to be used for mothers and children as it was meant, not for 1.4 million illegal aliens, not for able-bodied people.
Medicaid is not used for people who are not documented. Mr. Chairman, I just want to say here, the part that troubles me the most is that the Secretary is deeply worried about the deficit and is willing to knock 16 million, or he says merely 11 million people off their health care. Matters so much, but it doesn't matter so much if you're cutting taxes for billionaires. Then it's okay to run up a big deficit. I think that's wrong.
Senator Elizabeth Warren walks into this hearing armed with facts, clarity, and moral urgency, and she refuses, absolutely refuses, to let the Trump administration hide behind talking points or political spin. Her target, Secretary Bessent, a man tasked with justifying a bill that strips health care from millions while handing trillions to billionaires and corporations that already sit at the top of the economic food chain. Right from the beginning, Warren frames the issue with brutal precision. She lays out the stakes plainly. A Republican bill that kicks 16 million people off their health insurance and guts programs that help families afford groceries, all while delivering nearly $4 trillion in tax giveaways to the wealthy and well-connected. She doesn't allow this conversation to drift into vague abstractions about fiscal responsibility or economic growth. She centers real people, families, workers, seniors, children who stand to be directly harmed by these policies. And when she turns to Secretary Bessent, she begins with the simplest possible question: will this bill increase or decrease the deficit? You can see him wobble immediately. Instead of a clear answer, he dodges, he softens, he deflects. And this is where Warren's brilliance shines. She refuses to let him escape the core truth. Every independent, credible, nonpartisan expert, CBO, Penn Wharton, Yale Budget Lab, conservative think tanks, even the Wall Street Journal, agree that this bill explodes the deficit by trillions. The only people claiming otherwise are Donald Trump, congressional Republicans, and Secretary Bessent, the same group pushing the bill in the first place. Warren doesn't let him hide behind fantasy revenue projections or hypothetical tariff bills that don't exist. She keeps him fixed on the bill as written, the bill they are actually debating, not imaginary offsets that may or may not materialize. And when he finally slips and admits the CBO shows a $2.4 trillion deficit increase, you can see the entire argument collapse. Because his justification depends on a separate bill that has not passed, has no text, and has no authority to be factored in. Warren exposes that rationalization for exactly what it is: political fiction. But then she shifts into the heart of the matter: values, what we prioritize, what we choose to sacrifice, and who we choose to protect. Warren highlights the hypocrisy at the center of this bill. Republicans claim the deficit is a crisis when they're taking health care away from millions, but suddenly the deficit doesn't matter at all when the goal is cutting taxes for billionaires and giant corporations. She forces him to confront that contradiction head-on. Why is Medicaid spending unsustainable, but cutting taxes for the ultra-rich is somehow fiscally responsible? And that's where Bessent tries the same tired talking points about illegal aliens on Medicaid and able-bodied adults, rhetoric designed to distract from the reality that most Medicaid recipients are children, seniors, disabled Americans, and working families struggling to make ends meet. Warren shuts it down immediately. She knows the data. She knows the program. She knows he is using scapegoats to dodge the truth. This bill harms millions of vulnerable Americans purely to finance tax cuts for the wealthiest households in the country. Warren's final point cuts deeper than numbers or charts. She exposes a moral contradiction inside the Republican argument. If deficits matter, as they constantly preach, they should matter all the time. They should matter when the solution is ripping healthcare away from 11 to 16 million Americans, and they should matter when the solution is giving billionaires a tax holiday. But for this administration, deficits only matter when the burden falls on working families. They magically disappear when the benefits flow upward. This isn't just about numbers on a spreadsheet. This is about a worldview. It's about who government works for. Warren makes it painfully clear. Under this bill, the wealthy win and everyone else pays the price. So as you watch this exchange, pay attention to Warren's precision, her command of the facts, and her insistence on grounding everything in real-world consequences. And ask yourself, who is actually fighting for ordinary people here? Who is defending the right to health care, the right to stability, the right to live without fear that one policy change could pull the rug out from under families across America? If you value leadership that tells the truth and fights for working people, make sure you like this video, share it, and subscribe. More people need to see moments like this, moments when someone stands up to power and refuses to let the most vulnerable be sacrificed for the wealthy few.